talking about shaken baby syndrome in infants. Baby shaken syndrome is called the most common form of deadly child abuse in young infants. A sudden burst of anger and a few ticks of the clock can change an infant's life forever. Shaken baby syndrome is like that. Sudden, violent, and irreversible. As new mothers and as sleep-deprived new parents, we need to learn how to deal with stressful situations. Recently, my coworker lost her baby to baby shaken syndrome. The boyfriend at the time said she rolled off the couch. My coworker says she dreams every night of crying babies that fills her dreams with nightmares. Baby shaking syndrome is called the most common form of deadly child abuse in young infants. Today I will explain what baby shaken syndrome is and inform you about its serious consequences that can change an infant's life forever. Additionally, I will provide information on prevention and resources available. I will explain what baby shaken syndrome is. In order to understand the effects of baby shaken syndrome, first you must recognize the problem. One definition is a form of abusive head trauma. It only takes a few seconds of vigorous shaking, and it can leave internal scars that will last for life. To understand, in worst cases, brain swelling and damage, cerebral palsy, mental retardation, developmental delays, blindness, hearing loss, paralysis, or death. Now that you know what baby shaking syndrome is and some severe cases, let's take a closer look at what a child may experience in a less severe case. In many cases, infants may never be brought to medical attention if they don't exhibit severe symptoms and may live with the consequences of baby shaken syndrome every day. In less severe cases, a child who has been shaken may live with lethargy, irritability, vomiting, poor sucking or swallowing, decreased appetite, lack of smiling, or vocalized rigid seizures. Difficulty breathing, altered consciousness, unequal pupil size, an inability to lift the head, and an inability to focus the eye, track movement. Studies have shown 20% of infants die during the days following aggression, and those who survive, 50% suffer from a wide variety of disabilities, and only 30% fully recover. Now that you understand what baby shaken syndrome is and the consequences of both severe and less severe cases, I will conclude with what methods can be used by expectant mothers and sleep-deprived parents to prevent abuse. There are methods expectant mothers can use to prevent baby shaken syndrome. To prevent baby shaken syndrome, new mothers and sleep-deprived new parents need to learn how to deal with stressful situations. Hospitals are beginning to teach new mothers about shaken baby syndrome. The first hospital to offer this education is University of Louisville Hospital. The education program includes a video, a brochure, speaking with a nurse about the consequences of shaky baby syndrome, and tips of coping and how to deal with persistent crying. Today I have informed you on the topic of baby shaken syndrome in infants. It is my wish that after this presentation you will have a better understanding of what baby shaken syndrome is, the effects in infants, and the prevention and resources available. With this information you have gained, I urge you to help inform expectant mothers of the consequences of baby shaken syndrome and to use the methods and resources to help prevent baby shaken syndrome.